Hey there, Dr. Mark McCawley here, and today I'm going to be talking a little bit about how COVID and periodontal disease actually play together here. So the thing is, they both make each other worse here. So we know that if you have gum disease, you're actually much more likely to have severe COVID-19 infection. And the reason is actually twofold here. You actually get that bacteria that gets into your bloodstream, and it actually makes your gums more bleedy there. It makes them more bleedy, makes them more permeable to viruses as well. So those viruses can actually get into your bloodstream, get into your lungs, and they've actually been shown to cause COVID-19. So, also, it exacerbates pneumonia. That's another thing that can happen. With all that bacteria in your mouth, if you have severe gum disease, it gets into your lungs. You're constantly breathing in and out. That bacteria in your mouth gets into your lungs. It exacerbates pneumonia as well. And if you have COVID-19, it's going to make it worse, because we all know what actually gets you with COVID-19 is the pneumonia. That's what makes it much, much worse. So, if you think you want treatment, come on in and we can take care of you.